Good morning. My name is Etang, Abang, counseling lead at the Bridge Clinic, presenting donor and gestational carrier counseling in third-party reproduction. This is the outline of my presentation. I stand on the Human Fertilization and Embryology Act 1990, which recommends that counseling guidance and support be offered to individuals who want to donate their eggs, sperm, and uterus to couples or individuals considering third-party reproduction. The role of the counselor becomes to provide an enabling environment to allow for expression of feelings, of thoughts, and of emotions to be explored. It leads to the information gathering that is necessary to assess and evaluate the suitability of donors for the treatment. The counselor also provides emotional support and informs and educates on the implications and consequences of the process. The counselor will also help to identify areas of concern and address them with coping mechanisms, leading towards the building of a good working relationship between all parties involved in the treatment. So by counseling interventions, I'll start with the female egg donors, who by the process of their donation, we know is invasive, taking on hormones and the technical extraction of the eggs. They are counseled on the process, provided with emotional support and coping mechanism. The male counterparts who donate sperm, though not an invasive procedure per se, but counseling is provided on the process and emotional support as and when needed. So these are the criteria that will be looked into in considering whether a donor, male or female, is eligible to become a donor. A healthy woman within the age range of 21 to 31 years old, having a normal body weight and BMI, not having polycystic ovaries with genotype AA, all investigations negative, FSH of 4 to 8 international units, and having a regular period. Whereas for the male counterpart, the same age range will apply, a few variations there and there, considering that there could be known donors that are above this age with negative infection screening and sperm parameters that are within the normal range. Demographic details will be taken: name, date of birth, age, home address, telephone numbers, all the rest. This is to ensure that whomever we are engaging, we have authentic details about them. They can be followed up, they can be contacted, and they can be supported, not just being in the clinic. We also want to determine as a counselor, what is the motivation and expectations of these donors? They are known and they are anonymous ones. The anonymous ones, we know that they always state that they are for financial gains, whereas the known ones, familiar ones, family members, friends, and associates, they are typically donating for altruistic reasons, of which the counselor must ascertain that they are not coerced to donate and align financial motivations to compensation for loss of time and travel costs. During this time, it's very important that the counselor engages meaningful discussion to get to really know what motivates these donors. It's not just about the compensation. A lot of information is conveyed during this time, and the counselor takes it upon herself to make their exercise a service of worth, of a gifting to a family that could otherwise may not have children if not for their donation. This conveys self-worth, gives them good self-esteem, and they remain committed in the process. Their lifestyle is also explored to include good dietary habits, because they must eat well. If you don't eat well, garbage in, garbage out. And to exclude adverse medication, medical conditions, substance abuse, alcoholism, all other things that are contrary to donation of eggs. The individual's current state of life will be also explored to create the awareness that they will need to take time off, whether they are students, whether they are at work, to attend to clinic visits, comply with medical procedure, and be committed to the treatment. This awareness is important because some people find it ad hoc to manage the requirements. Information and education on implication and consequences of the treatment, present and future, is a drive on to ensure that they understand what they are taking on presently and what could be the consequences in future. That screening for infectious disease, knowing the state of their genotype and blood group and all the rest, is mandated predatory, is for their own good. And in the process, conditions that they may never know could emerge. If it is treatable, it is treated before the treatment. If not, it could disqualify them for carrying on with the donation. Female donors will have to know and taught and encouraged and educated to self-inject themselves. First-time donors are very frightful, but with support and counseling, they get on and they become pros. Medical risk of abdominal pain, discomfort, bloating, and on rare occasions, OHSS. Those occur, we have to inform them about this, that there are protocols put in place to manage, to ensure that they do not occur, and when they do occur, they are properly managed to ensure that their welfare and well-being is properly taken care of. Irrevocable consequences of children existing that they may never know and would not know of what may become of them in the future is also conveyed to them to consider. Are they willing to have this behind their back while they go on to donate? Can they live with it? They have to consider all this. Most importantly, we bring in the information that they'll need to give legal consent, the legal requirement to proceed. Nobody can make you a donor without you consenting. But by all these informations and more emerging as we go along, that they are well equipped with information, given time to reflect and to decide, and then give informed consent to either carry on with egg donation or to refuse to donate. Meanwhile, support emotionally with coping strategies is given throughout to reassure, encourage them, and allay fears and anxiety that enables them to donate and manage the stress of the process. This is all about egg donation, and I want to carry on to talk about gestational carriers and counseling interventions. These are the criteria that we'll be looking at in making sure that they are eligible to become surrogate mothers or gestational carrier. Age of 21 to 30 years old, one term uncomplicated pregnancy that resulted in the delivery of a healthy child, not more than 3 deliveries and 2 cesarean section deliveries in those 3 deliveries. Surrogate and partners are screened to ensure that there are no infections, because don't forget, they will live in the same roof. Stable environment and adequate support to help them to cope with the additional stress will also be elicited before they can be eligible to carry on. Then the full demographic details of these donors is taken to ensure of their name, date of birth, age, that it corresponds with the criteria to be a surrogate. For the necessary reasons of reaching out, contacting them, supporting them, follow up, all these details are collected from the surrogate, the partner, and for the next of kin. But majorly also, we evaluate the ability to physically and psychologically cope and comply with the demand of the process. So we'll be looking at relationship status. Are they single or in a stable relationship? Are they married? If they are married, they are counseled together. We want to ascertain, is the partner aware of her surrogacy plan? Has he given permission for her to surrogate? Will he support the surrogacy process? Single moms in this case will have to provide additional information regarding the relationship with the father of their existing children. We want to ascertain, what influence does he have with her? Is there a potential of him jeopardizing the surrogacy treatment? This information the counselor will have to look into. For existing children in a stable relationship, we take details of each birth of the child, antenatal, delivery mode, what happened after post-delivery, to exclude any abnormalities that would not like to be taken into the surrogacy treatment or that could affect the surrogacy program. The motivation and expectations will also be explored. Anonymous carriers will always typically come out to say that they are here for financial gains, but at the same time, they have goodwill. The goodwill will have to unfold as the treatment goes. But for familiar donors, known donors, friends, associates, and family members, who will always as that altruistic motivation, we have to rule out that there's no coercion. And in either case, we ensure that there is a solid agreement with the intending parents to cover surrogacy expenses. Lifestyle issues will be explored also by the counselor. What are we looking at for? Do you have good eating habits? Because it is known surrogates have early pregnancy loss due to poor eating habits, poor self-maintenance. This has to be explored, educated, and managed, and we have to exclude adverse medical conditions or medication, substance abuse, alcoholism, and all the rest. The current living arrangement will be explored to know the family type, the home influence, the stable home environment. Will it support her or will it negate her efforts to be a surrogate? The impact of her current life situation. Work arrangement is very important. If the work is studious, it will affect and add stress to the surrogacy program. So as such, we also look at whether she would be aware of the time that she needs to take to visit the clinic and comply with medical procedure. She needs to arrange with a network of supporters for that. What is the nature of work? Is she employed? Is she self-employed? Will she continue to work, or will she leave early to accommodate the treatment? Or if she's self-employed, is there adequate financial support to ensure that she is at peace to undertake the surrogacy treatment? Furthermore, we go on to educate them and provide information on medical risk and health factors that could impact the surrogate's health. The possibility of a multiple gestation. Yes, in our environment, this is very welcome. I mean, after so many years of childlessness, you want it to come in multiples, but it comes with associated risk that must be spelled out so that the surrogate will be prepared. If she has never had twins particularly, that there will be issues of preterm and low birth weight, and she must take care that in case of early hospitalization for rest, she will have to take this into consideration and be prepared. Issues of disability in pregnancy or at birth, for consideration to rule out rejection by the intending parents. Has this been captured in the agreement? The counselor must have to discuss and bring into awareness to be prepared and ensure that all things are in place to have a progressive treatment. We educate on the potential for cesarean section as a likely option for delivery so that they will be prepared, particularly if she has had 3 pregnancies of normal delivery and now she's faced with an operation. It's an event that is not welcome by most surrogates. They need to be counseled that care and support will be there and medical attention will be provided. We discuss the emotional and psychological issues, present and future consequences of the treatment. Information that will impact her to consider, do I need to give a consent to do this? Do I need to step back? Is it worth the financial gains, effect on her sexual life during pregnancy, the decision on how to inform present, future children and future partner, the difficulty of carrying a non-genetically related pregnancy, effects of parting with a child and re-registration of every detail from pregnancy onto the intending parents, the impact of treatment on ability to have more children in future, exclusion to breastfeed and managing that, coping with postnatal period. These require deep and meaningful discussion that enables her to consider, clarify in her state before she can give a consent to carry on with the treatment. Further investigation and discussion will also be looked into religious preferences, cultural values, with modification to tender any negative influences that may be coming from these areas so that she can be at peace to carry on the surrogacy treatment. The need for a network of support workers will be also raised for consideration for action to be taken, especially being counseled on disclosure to family members, associate friends, etc., that they could be enlisted and relied on for support during the treatment. Paramount and important is the legal concerns and implications to ensure that there is a solid arrangement for surrogacy between the commissioning intending parents with adequate financial support to handle all treatment expenses. This is that her mind is at rest, that should be taken care of while she's doing this good job. And thereon, after further consideration and deliberation, allowing her time to reflect on all that has been communicated to her and all that she would want to be counseled on, would she be ready to give an informed consent or would she be refusing to proceed on the treatment? There's no question, it's for her to consider, but there must be an informed consent to proceed on that treatment. The counselor goes further on during the relationship in counseling gestational career to manage relation boundaries between all parties, particularly the intending parents, the treatment center, and the person carrying the baby, the surrogate mother, to ensure that everything works out well. With continuous emotional support, coping strategies throughout the process, with reassurance and encouragement to allay fears, anxiety, while enabling the surrogate to manage the stress of the process. I want to draw our attention to two case studies to highlight the significance of counseling guidance and support. One for egg donor suitability and the second case for gestational carrier. Potential donor Miss Ollie offered to donate her eggs based on the experience of a friend who had successfully donated twice. Miss Ollie was unaware of the donor suitability criteria. Her medical screening results revealed that she was AS genotype, which disqualified her from proceeding with the donation process. This news was a shock as she was unaware of her genotype before. She was also disappointed because being disqualified meant she would lose out on the financial compensation. Support counseling enabled Miss Ollie come to terms with the loss of compensation and news of her genotype. She was able to see the mandatory screening as a benefit of offering to donate, which provided her with information she would otherwise not have had. The second case study is on a gestational carrier suitability. Potential surrogate, Mrs. Oz, provided as an anonymous surrogate by an agent, previously volunteered and successfully donated eggs earlier in the year. During the counseling session, it was discovered that information provided during donation process as single with no children was different from information being provided for surrogacy, single with 4-year-old child. When further clarification was requested, she admitted to falsifying her information to fit the surrogacy acceptance criteria of one normal delivery of a healthy child. She was educated on the implication of providing false information and disqualified as a surrogate. Point to note, anonymous surrogates who are primarily motivated or driven by the potential of financial gains can falsify their information to meet the surrogate acceptance criteria, of which the counselor should take cognizance of and address in furtherance of a progressive and successful surrogacy outcome. In conclusion, I want to state that the services of garment donors and gestational carrier are crucial in third-party reproduction, which is a complex and delicate process. Counseling includes the thorough gathering and providing of information to convey all the associated implications and consequences of the process to ensure that the interests of all parties are considered. Counseling is required to enable parties make informed decisions, potentially leading to the consent or refusal to treatment. Counseling serves to alleviate fears, concerns, enable parties manage stress, and provide the necessary emotional support and coping mechanism. Thank you. These are my references.